Guests on Keel heard via the Jack Spring Electric Keel Newsmaker hotline. Not that they're on the phone right now. Would you please introduce, with a flourish, our two guests?
So excited. Dr. Martha Whyte, Regional Director of the Office of Public Health for our area.
We promised Martha
right?
on the phone. We promised Dr. Martha on the phone during one of her many calls that when they opened the doors, when we reached phase 44 or whatever it happens to be, that she would be our first in-studio guest.
Yes.
But she's not the only first in-studio guest.
I brought a surprise for her. I brought David Langston in. He was patient X, the first COVID-19 patient in our area.
Now, Ms. Martha, explain to everybody what your connection with David and his bout with coronavirus happens to be.
Well, David and I met over the phone when he first was diagnosed because, there's a fear with it. And we talked a lot and became friends over the phone. And when my husband became sick, he said to me, I want to give him my antibodies. I want to help if I can. And so because of that, I said to my husband's doctors, I have someone who wants to try to donate plasma. And they said, see if we can do it. And they found a protocol, and they were the first in the state, second in the South.
And he was a match. How ironic is that?
Right, A positive. It was Lord driven. I promise it. But he's my hero because my husband would not be here if it wasn't for him.
You truly believe that?
Oh, I know it. Yeah, I know it.
How do you feel about that, David?
It was probably the silver lining on the cloud. I was like, how could I have got this coronavirus out of all the people in the nation? Because at that time when I got it, there was very few people that had it. And I was like, I felt kind of negative and really, I was pretty upset, how of all people. But then I guess you could say now, looking back, there was a reason for it because I got over it fairly easy and I was able to help somebody.
And you are continuing to donate plasma, antibody plasma. So in addition to Martha's husband, also a physician, you really don't know how many people you've helped or how many people, bluntly, that you've saved.
Well, I'm going to continue giving my plasma because I've got the antibodies in there that will help some folks that, maybe just need that little boost.
Martha, how's your husband now?
He's doing really well. I mean, he's truly a miracle. He's already walking without a walker. 50 days with not moving a muscle. He couldn't even get out of a chair.
He was on a ventilator at one point for a long period of time.
40 days.
Wow.
Longest.
Wow.
Yeah.
Okay, we are hearing the news today that I think the number is 20 states are now having an increase in cases. It's making a resurgence.
Right.
How worried are you about that?
I'm very worried about that. It's very disturbing to me because you can see it in our community. People feel like we're through it, and they're not wearing masks and they're not social distancing, and I'm very afraid for what this next.
But is it and you obviously you're speaking as a physician, as a medical person. But isn't the genie out of the bottle? Isn't the horse out of the barn? People aren't going back. They can make all the rules they want, but do you really think at this point people would go, I'm going back to the way it was in the middle of April?
Well, I'm not asking people to go back to the way
I
it was
didn't mean
in the
to
middle of
imply
April,
that.
but no, I do think people are tired of it. They're tired of it, and they've been through a lot, and it's an emotional toll on people as well as a financial, and I get all of that. But until it hits you personally, it doesn't seem to make resonate with people. Mm-hmm. And the sad part is, I didn't get to see my husband suffer. He suffered greatly. But there are people suffer at home who can't breathe. Can you imagine watching someone you love cough and literally be short of breath to the point where they're just suffering? And that's what people are going through with this virus. If you get the bad form of it, and nobody knows who's going to be hit hard and who's going to not. We have 92-year-old people in a nursing home who really don't get much of a symptom.
Let me ask you about that, because you look at, for example, the state of New York, where Governor Cuomo said, okay, I'm mandating that you move the infected senior citizens into the nursing homes with the uninfected senior citizens. And thousands of people died. And yet you see a situation like Florida, where at the Villages, this massive retirement home, literally, virtually nobody got sick and nobody died. How do you account for that? Is there...
Well, I will say in Florida, they didn't do a whole lot of testing. So how many people got sick, I don't think we know. Now, obviously, we know they didn't die unless they didn't test people who passed away to see if they died of COVID. Here, our coroners, if you passed away, they want to know whether you were COVID positive or
What does a
not.
physician think about that, by the way? Where the joke was going around, somebody gets run over by a Mack truck and you died of COVID-19.
So that's not the truth. I mean, nobody's going to die of COVID in and of itself. You die of a complication of COVID. So you may die of respiratory, like a pneumonia, or you may die of heart failure or kidney failure, multi-organ system failure. There's a lot of things, a stroke that comes of you having COVID, but if not for the COVID, you wouldn't have had those things happen. So that's why it becomes a COVID related death. COVID in of itself is just a virus, and it's really not going to cause you to die. It's the complications, just like the flu. Nobody dies of the flu. You die of a pneumonia from the flu, or complications that you get from the flu.
What, Martha, should we be doing? Me, I'm not. If I had to tell you, I'm 40% worried about getting it, I guess.
Right.
What should I be doing in my daily life when I go to the grocery store, when I go to see friends, etc.?
Right. So what I try to tell people is nobody's asking you to wear a mask 24/7. What we're saying is be smart. If you can social distance, then you're okay. If you can keep that distance between you and the people. When you're walking into a place where you're going into a crowd, or like these protests, or something where that you can't assure yourself that you can keep that distance, or that people will from you, then you need to wear your mask. And you need to keep your hands off your face. That's a huge part of it.
Even somebody like David who's already had
Yeah,
it.
David is pretty safe right now. So he's got antibodies. We know he has antibodies. So he's probably the safest one among us. He can't get it, and he
looks
can't
a little
give
dangerous.
Yeah.
Okay.
He can't give it to anybody, and he can't get it. Now, how long he won't be able to get it, we don't know for sure. We don't know if it's like lifelong immunity. Probably not, but it's definitely through this.
Is it lifelong
round of
immunity
it.
with other COVID infections that have been?
It has not been. Well, COVID we don't know, but other coronaviruses.
Yeah.
But somebody said there's a memory, that it develops a memory,
You
and
do.
you get through it easier.
Okay.
Your
Is that
immune
right?
system does develop memory cells, and so if you become to the point where you can get it again, your body's already ready to fight it.